call right here. This is not about politics. This is about morality.
Health emergencies can't wait for us to have some theoretical debate about some better idea that will never, ever come to pass.
We are behind every country pretty nearly in Europe in this matter of medical care for our citizens.
I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery.
I'm Benjamin Day.
I'm Stephanie Nakajima.
And this is Medicare for All, the podcast for everybody who needs health care.
Except for the creators of the Iowa voting app.
I'm not sure I even need to ask you why you're leaving them off, but do you have any specific reason?
Well, they did help us kick off the primary season with an epic blow to faith in our democracy. But also a blow to capitalism as the solution to the problems of democracy.
Well put.
It's a silver lining.
Democracy is so overrated anyway, though. So as you were saying, a few things have happened in this past week since our last episode. There was the Iowa caucuses, epic debacle. There was an impeachment vote in the Senate. There was Trump's State of the Union address, which we all enjoyed listening to. There was a New Hampshire Democratic primary debate because as we are recording this, the New Hampshire primaries are tomorrow. As you were listening to this, they are happening right now. And then most importantly, of course, the Oscars happened on Sunday. So my question for you, Stephanie, is what was your highlight of your last week, even if it had absolutely nothing to do with any of those things?
Well, I'm just going to be basic and say that actually Parasite winning Best Film was the highlight.
Oh my God. You straight up love that movie?
I did, and it's just a whole thing about, Asian representation in media. It's really, really bad. We're either, martial arts masters or freaky-ass ghosts in horror shows, or in the case of women, like sexual curiosities or cutesy, like personified Hello Kitties, or both. So for me, it's just amazing to see a story come out of East Asia that deals with universal themes of human experience that resonate with a Western audience.
That was quite a pitch. I have not seen the movie, but I did watch the Oscars, and they cleaned up. They cleaned up in all the categories. They were single-handedly taking on Oscars So White. If it weren't for that movie, the Oscars would have been in trouble this year a lot also. So for my highlight of my week, one of my New Year's resolutions, I don't really make New Year's resolutions. I make a New Year to-do list, which is so lame, but so me. And on my list is to master Eggs Benedict. And the hardest part of the Eggs Benedict is the hollandaise sauce. And I've tried multiple times. My hollandaise sauce tends to break, so the butter separates from all this stuff, and it looks like you have a tiny little scrambled egg sauce, which is disgusting. But over the weekend, it held together. And it was beautiful and delicious and very bad for my calorie count.
Oh, my goodness.
But major achievement.
I'm going to have to introduce Ben to Nora's hollandaise sauce packets.
No, don't do it.
$1.99 Market Basket.
Oh, no, that's cheating. I can't. It wouldn't satisfy my New Year's resolution. So I guess we're going to jump into Iowa first. So one of the most interesting things coming out of the Iowa caucuses, aside from, the election outcomes, was that Edison Research, funded by the Washington Post, did entrance polling. So this is where they survey people who are going in to actually vote, talking to actual voters. So entrance polling and exit polling tend to be the most reliable, more so than just calling through phone banks and trying to figure out who's a voter and who's not a voter and asking them questions. And they asked Iowa caucus goers whether they support Medicare for All. But because this was a Washington Post poll, the wording was highly, I'd say, antagonistic towards Medicare for All. This is the question they asked. They said, how do you feel about replacing all private health insurance with a single government plan for everyone? They don't use the word Medicare for All, which polls very well. Nonetheless, 6 out of 10 Iowa voters said yes. They support replacing all private health insurance with a single government plan for everyone. Takeaway from that?
Only because they've been inoculated against that argument already, because the Washington Post has been using it for the past year.
Constantly.
And I think it that poll sort of belies the establishment narrative that supports, the idea that support for single payer plunges when people realize it means getting rid of private insurance. It's always interesting, I think, that these polls test what happens to support for Medicare for all when you tell them it takes something away, and they never test when, people find out that it actually
what you gain.
Yeah, what you gain, that you get, you get your copays and deductibles taken away, or that you still get to see the doctor of your choice, and actually your doctor of choice, of course, expands because it eliminates networks. Would love to see polling on that.
Yeah, and I mean, some people claim that it's polling, like what happens when you add details to what happens with the Medicare for All plan, but in reality, a lot of this is just opposition research. So they're testing what are the lies you can tell about Medicare for All that work the best. And what they've found generally is that if you scare people that they're going to lose Medicare, that works effectively. The Medicare that they have right now under Medicare for All, ironically. And then if you scare people about losing their private health insurance, that's the other thing that works really well, also a lie. And of course, using this framing of like government-run healthcare tends to scare people off. So WAPO just kind of combined together all those opposition research findings into one question, and yet still 6 out of 10 Iowa caucus voters supported it. And to me, what was interesting is that is way, way more voters than voted for Bernie Sanders or Elizabeth Warren, right? Yeah. This is clearly quite a few Biden supporters, Buttigieg supporters. I mean, especially Buttigieg supporters who did really well in Iowa. Any other takeaways from Iowa before we move on to the wretched State of the Union address?
No, but just to add on to what you're saying about that, I think Medicare for All suffers from political feasibility in the same way that progressive candidates suffer from concerns about electability. So I think that in the same way that candidates can benefit from momentum, so can progressive ideas like Medicare for All, because people, they may support Medicare for All, but they think it's not politically feasible, and then when they see that it does become politically feasible, then they can jump on the bandwagon. So I think that the polls that show there are people who voted for Pete Buttigieg or some more moderate candidates, but also do support Medicare for All, can easily be captured by our movement once the momentum is going, because they're not, ideologically opposed to Medicare for All. And
lo and behold, even a lot of independents, vast majority of independents support Medicare for All, and not a majority of Republicans in most polls, but a very sizable percentage of Republicans as well.
We're coming after your voters too, Republicans.
That's right, and all the other fringe parties. I think 1,000% of Green Party supporters support Medicare for All. So speaking of Republicans, shall we transition?
So this week, Trump gave his State of the Union address, which I could not bear to watch. So we're going to have to rely on Ben's insights here. I did read some of the coverage. Apparently, among many of Trump's straight-up lies about, his record on healthcare, he claimed he protected pre-existing conditions during his term, that he brought down drug prices. In addition to that, he also went full McCarthy on Medicare for All. So let's listen to that clip.
Yeah, and I suffered through this whole State of the Union address just so I could pull out the clips and you could listen to them in isolation. But even the small sections are going to be a little bit painful. But let's listen now.
But as we work to improve Americans' health care, there are those who want to take away your health care, take away your doctor, and abolish private insurance entirely. 132 lawmakers in this room have endorsed legislation to impose a socialist takeover of our healthcare system, wiping out the private health insurance plans of 180 million very happy Americans. To those watching at home tonight, I want you to know we will never let socialism destroy American health care.
Wow. That was a nostalgic little trip back to the 50s.
Yeah.
Ben, what do you think? Is Medicare for All a socialist takeover of healthcare or a communist takeover of healthcare? Did he go far enough?
That sounds like a Washington Post polling question. I don't know how to answer. Yeah, I mean, this is, I would say that Trump did not turn to poll-tested messaging here. Or, this is not straight out of the focus groups. I kind of feel like the socialist attack on Medicare for All is less effective these days. Maybe with like hardcore, like with his base, I think it might work.
A little bit of boy cried wolf, everything is socialism, and now it's almost...
And, we should also mention that later in his speech, he says, "I will always protect your Medicare and your Social Security," right? I mean, does he think that Medicare is a socialist takeover of healthcare for seniors? Is he defending socialism for seniors, but defending us from socialism for everyone who's under 65? I mean, totally incoherent, I think. And I also noticed during that clip, you'll notice he did not use the term Medicare for All. Also didn't use the term single payer, just because I think the cognitive dissonance of calling it Medicare for All and then defending Medicare in the next couple paragraphs later is just too much even to listen to. But you did notice the clip where he said it's going to take private insurance away from 180 million people who are so-called happy with it. And you and I are both among those 180 million. We have the best healthcare we can buy, and it still fucking sucks. I'm not happy with it.
Absolutely sucks.
Just the copay. We get the best plan you are allowed to get through the exchanges, a platinum level plan. And the deductibles and copayments and limited networks are still just astonishing. Like our day-to-day fights with our insurance companies that we talk about in the office are ridiculous. So that claim obviously is insane, but this was the first time I've heard Trump use the argument that Medicare for All is going to take away your private health insurance from 100 and however many million people. I've never heard him make that argument until today. I wonder where he got it from. I mean, have you heard this argument anywhere else recently, Stephanie?
It's amazing because when we were naive waifs at the beginning of our single payer career, we thought that attacks were going to originate from Republicans. And it turns out now that actually we have to fight the establishment Democrats before we get to the big boss,
I thought we'd be arguing about long queues and waiting times.
Exactly.
Not a socialist takeover of healthcare. But yeah, this talking point is straight from Joe Biden's campaign and Pete Buttigieg's campaign. They're the ones who have sort of polished off this anti-Medicare for All messaging, trying to scaremonger about how it will impact people with private health insurance. Of course, it would take away your deductibles, your copayments. You would never lose health insurance ever again. Your employer wouldn't get to decide what kind of health care you have. I'm about to go off on a rant. I'm going to stop myself right there because I know there's a lot more to talk about. But,
it does say something about how disingenuous the arguments against Medicare for All are becoming because, as some of the arguments that we've used before, like rationing and wait times and that kind of thing, they seem to resonate a little bit less. They sort of turn to, trying to scare people a little bit away from losing what they have. And I think that, that argument isn't going to last that long either.
Yeah. I mean, the last thing to say about this quote, and then I'll stop ranting, it does mark like the full evolution of Trump on healthcare. People hopefully know that Trump was basically a Medicare for All supporter for almost his whole life. He wrote about it in his book, in his autobiography, how he supported Medicare for All. He was challenged about it during the Republican primary debates when he ran in 2016. And then even when he ran in 2016, he kind of abandoned his support for Medicare for All. But he had some maverick Democratic-ish positions, like he wanted to have Medicare bargain for drug prices, which is like a staple Democratic position.
He supported abortion.
Yeah. And he's now fully evolved to a total right-wing free market ideologue who is making socialist attacks on anything that is not hyper-capitalism, essentially.
Says something about how deep his convictions were
right.
all along.
I don't think he has convictions.
No.
He's just a wind-up robot. So, but yeah, this is where we've ended up. He ran on draining the swamp, and now he is the swamp, basically.
Yeah. So aside from the socialism stuff that was, brought up in Trump's State of the Union speech, he also made the classic sort of undeserving immigrant argument against Medicare for All. Let's roll that clip.
Over 130 legislators in this chamber have endorsed legislation that would bankrupt our nation by providing free taxpayer-funded health care to millions of illegal aliens, forcing taxpayers to subsidize free care for anyone in the world who unlawfully crosses our borders.
And there it is.
So Ben, of all the ways to attack Medicare for all, I mean, he could talk about the cost, he could do the classic Republican rationing, you know. Why talk about undocumented immigrants who make up such a small percentage of the country?
Well, you know, this obviously fits with his wall messaging, which I think this was actually his transition to just anti-immigrant ranting and about how great his wall is that he claims he's building. But, you know, I'll say one thing about this. You know, both you and I have done a lot of canvassing over the years where we just go out and have to talk to people about Medicare for all. Maybe we're gathering signatures for a ballot initiative on Medicare for all. Yeah. I have never once in my life had someone express worry about a socialist takeover of their healthcare system when we're talking about Medicare for all.
It happened to me once in the financial district.
What were you doing canvassing in the financial district?
This was before I knew the layout of Boston, and I had accidentally wandered into it.
Downtown.
I know. It's like everyone here is wearing a suit.
Right. Well, that aside, I've never had this sort of socialism, red baiting, fear mongering from an ordinary, normal person on the street.
I agree.
But I have been shocked by how often I do hear from people who are afraid that it's going to cover undocumented immigrants. They usually say illegal immigrants. They say, is this going to cover illegal immigrants? And that's, I appreciate that they ask it because you can then have a conversation about it, which probably most people don't get a chance to have. So this is an attack from Trump that, you know, like everything else, it's clearly, you know, it's a rhetorical device for him. I don't even know what he believes on this issue. But it's something that I think we do need to be able to talk to other people about on the ground. So it's an important issue to address, I think, Trump aside.
Yeah. We don't want to end up like the European countries who created a solidarity around basically their own ethnic groups. Yeah. The Danes think of themselves, you know, as a tribe, and now they're having difficulty incorporating immigrants, especially immigrants who don't look like them, into their welfare society. And I think that that's why it's so important to build like a multiracial, you know, multi-ethnic coalition around our rights.
Yeah, yeah. And when I talk to people about this, I think there's two important points to make. One is that this specter that Trump is raising of essentially, U.S.-born taxpayers subsidizing immigrants' healthcare, free healthcare, is false. Yeah. It's just a false narrative. The actual truth is the opposite. That immigrants subsidize the healthcare system for U.S.-born residents. Massively subsidized. And there was a great research article done in 2013 by actually a number of our friends in the Medicare for All movement were involved with it. And they looked at just Medicare Part A. So this is just the hospital part. And they found that between 2002 and 2009, immigrants contributed $115 billion more to Medicare than they took out of Medicare, than they received in benefits. And that, again, is just hospital coverage, so the number is even staggeringly more large if you were to include like physician care and prescription drug coverage. On the other side, U.S.-born people generated a $31 billion deficit just on their own. That means they were using way, way more benefits than they were putting back into the system. And there's a few reasons for this. One, obviously, immigrants are overwhelmingly tend to be younger and also tend to work. So that means they are paying into the healthcare system through the payroll tax. And they're not taking out the system until they get much older. But even then, many immigrants who do pay into this system are not even eligible to get the benefits when they get older. Obviously, all undocumented immigrants are not eligible for Medicare benefits once they turn 65. And there's a number of documented immigrant categories who also cannot receive Medicare benefits, even when they have done everything the right way legally and turned 65. So the truth is actually that the best thing you can possibly do to keep your healthcare system financially solvent and to protect the healthcare of U.S.-born residents is to have as many immigrants in the system as possible. So that's like number one.
Yeah, and absolutely. I mean, Medicare for All is also a justice movement for immigrants who are paying into a system that they cannot draw upon. And that's just the tragedy of it, is that they are scapegoated for increasing Medicare costs or for not being able to have a universal health care system when actually they're the ones keeping it afloat. Such a tragic irony.
Right. And actually, there's a whole other conversation about how a lot of barriers have been set up to getting Medicaid in a bunch of states where they add these ID requirements and things that they claim are to keep undocumented people off of Medicaid, but in fact they almost only keep off older people who have a hard time getting their records, or maybe they've lived through a natural disaster like a flood or something and their records are gone. So those systems generally don't keep out any undocumented immigrants. They only keep out documented people. It's sort of like the voter disenfranchisement movement. But the other thing I think, aside from the cost argument, is just like you were saying, like we have to make a moral argument, and I think take the moral part directly on. We do have a law in the United States that says hospitals are not allowed to turn away anyone who needs emergency care, regardless of their status, regardless of anything else. It's just illegal for a hospital to say, no, we're not going to care for you if you show up with like a broken leg, or if you're bleeding, or something is truly urgently wrong with you. And this legislation was passed by the Republican Party, a number of decades ago. But I think that's an obvious moral thing, right? I think almost all of us believe that to have someone come to you urgently with a broken leg or something, to send them home to die, is immoral under all circumstances, right? But what we don't talk about is to deny people access to a health plan that gives them preventive care is also killing them.
It's the same thing.
It kills them further down the road. So
yeah.
I truly believe we just have to make this a moral case. I think it's a moral case that spans the parties, but people don't always think about it. All right, so next up, we had a Democratic debate in New Hampshire, which is the next primary state coming up. And yet again, Medicare for All kind of dominated this debate discussion and was just like a crucial issue distinguishing the candidates from one another. And there was a few different discussions that came up around Medicare for All. We'll kind of break them down one by one. But the first I want to talk about, there was kind of a fiery exchange between Pete Buttigieg and Bernie Sanders about whether Medicare for All is a divisive issue that, divides the country. This is what Pete Buttigieg has been claiming, or whether it's in fact a policy that unifies and brings together working people, which is what Sanders argues. And this is, interestingly enough, Pete Buttigieg has not, as far as I know, been making this argument about, it costs too much or it kicks millions of people off of their private health insurance. He has mostly been making this argument that it's divisive, it's politically divisive, and people should have a choice whether they want it or not. So we're going to play actually not a clip from the debate, even though he said similar things, but we're going to play a campaign ad that Buttigieg just recently rolled out that makes essentially the same argument.
Medicare for all who want it can work in a way that creates that public alternative, gets everybody covered. But unlike the Medicare for All plan, it doesn't dictate that to the American people and risk further polarizing them.
So, Stephanie, what's your takeaway on this? And again, we get like new arguments about Medicare for All rolled out almost on a monthly basis.
Hard to keep up with.
Yeah. So what's your take on this like divisiveness framing of an attack on Medicare for All?
Wow, dictate is quite a choice of words there. I think what he really meant to say was, my billionaire supporters do not want to be dictated to pay for the plebes' health care. Guess it didn't go that well in the wine cave.
Right.
Wasn't that popular.
Right. So who is divided from whom
yes.
is the question here.
Please do not polarize my donor base.
Right.
What's ironic, I think, about that framing of the loss of private health insurance or, the choice is actually that's the most divisive argument, because its very purpose is to pit Americans with, private employer-based health care, already, an unfortunate lot in the global scheme of things, against a group even more unfortunate, which is Americans without employer-based coverage, by instilling fear, in the haves of what they could lose by expanding coverage to the have-nots. And so Pete Buttigieg is actually the one creating this division, but the division is down class or privilege lines, and not by honest differences of opinions among Americans, which is total bullshit.
Yeah, and to be clear, Pete Buttigieg's health care plan does not cover everyone. It's not a universal health care plan. He stole it from Joe Biden. And Joe Biden stole it from the Third Way Institute. So his is basically a public option, and then you kind of extend the subsidies up a little bit higher than the current Affordable Care Act subsidies go. But they still don't cover everything. You still have to buy it like a commodity. So it's not a right. I do notice, especially when he's talking about, you highlighted the use of the word dictate. He often uses the word command. he uses like military terms to describe what it's like to be given free health care. It's like, you can't be commanded to have comprehensive coverage. That's a right. And with a lot of these messaging, I like to just insert public education instead of, or public schools instead of Medicare for all, to see just how absurd it sounds. I mean, would it be like, command you to have a right to to a free education, primary education? The language is just totally, at that point, I think, transparent. So.
Yeah, and it's picking up exactly where the insurance companies' spin rooms have left off, with seeing that actually choice wasn't an advantage of employer plans because they save money by restricting choice. They do actually the opposite, right? They make your network more narrow, and they give you less options because they put cost barriers in the way. And so they tried to flip the script by saying, actually, you need a choice of a private insurance plan. And Pete Buttigieg is just taking that argument and creating free PR for these insurance companies for their model of the world, which obviously benefits their bottom line and not.
Yeah, and if he and the insurance companies are being honest, he would not say you get a choice. He would say your employer gets a choice for you.
Exactly.
Right, your employer gets to choose which health plan you get to stay in, whether you get a public or a private one, because as we know, most people who are not in a public insurance plan have it through their employer. They choose it for you.
You don't choose your network. You don't choose,
Yeah. So you don't get to say, oh, I want the Medicare-like plan. That's going to be your boss who says it for you. And they also get to keep saying, do you get abortion access and reproductive health care coverage? Your employer chooses that for you as well.
And implicitly, they get to take that away from you if you decide to leave that job.
Right. Or if they just feel like it and want to spend less money. Exactly. So, Bernie did have a chance to rebut that. And he gave his, I think, his argument was just that this is a proposal like many of his other proposals that kind of unites the working class. But we're not going to go through his clip, because we also want to talk about Joe Biden's attack on Medicare for All, which he takes a very different tack than Buttigieg. And he picks it up from this, is this divisive or not? So I want to listen to a Biden clip, and then we can talk about that and sort of his different attack on Medicare for All.
Look, Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to tell us what the damn thing's going to cost. The fact that we're in New Hampshire, a very level-headed group of people, look at the numbers. How much is it going to cost? Who's going to pay for it? It will cost more than the entire federal budget we spend now. More than the entire budget. The idea middle-class taxes aren't going to go up is just crazy. When they did it in Vermont, what happened? They doubled the state income tax and then had a 14% tax on withholding. And they finally did away with it. So how much is it going to cost?
I wish, dear listeners, you could see Stephanie's facial expressions during this podcast. There's so much to unpack there.
There's too much to unpack.
Starting from New Hampshire, a very level-headed group of people. Look at the numbers. What numbers is he talking about? What unit of measurement do you use to measure level-headedness?
On the Biden to Trump scale, I guess? I'm not sure.
He's up there in not level-headed land at this moment. I feel like I would be very high on the level-headedness scale. I'm pretty level person.
And we're single-payer supporters.
I know, exactly. I think it's just like code for you're a bunch of centrists. This is what he's saying, but / hoping. It's sort of like when Amy Klobuchar is like, fiercely independent New Hampshire people. It's like, you would never vote for the front runners, would you? But what about this thing he goes on about Vermont? And to quote, he says, when they did it, meaning Medicare for All in Vermont, what happened? They doubled the state income tax, then had a 14% tax on withholding. And he has this whole thing about doubling the budget, the federal budget, and so on and so forth. Where do we start?
Well, first of all, I feel like the attacks on Vermont are like a game of telephone. The stories about what actually happened in Vermont with their single-payer proposal, they just get crazier and crazier with each telling. I feel like the next thing we're going to hear is that Vermont instituted a single payer and then they were annexed by Venezuela or something like that. I mean, it's just such a crazy. I mean, Vermont never even implemented a single payer policy.
Right.
It died actually before it could even get off the ground, and yet you hear all about the failures of the single payer plan in Vermont. So I think that's the first thing.
It's a little sad that even with a large campaign staff and probably a research team, Biden is like 20 people at the end of the telephone game removed from what happened in Vermont.
Yeah.
But it may be a willful misremembering. To be clear, there was no tax in Vermont. There was no single payer plan in Vermont. No. It was stabbed in the back by its own creator, the governor of Vermont, Governor Shumlin, who had championed it for many years. But then when it came to a crucial step where he had to come up for how to pay for it, which is allegedly what Biden is talking about, he said we shouldn't do this at all. So there was no financing plan and there was no Medicare for all coverage, unfortunately. And what about the cost thing, the doubling federal budget?
Yeah, so that is just such a wonky conversation that I'm not even sure people really care about. I think maybe it scares people because they think that it's so unrealistic. But one of the things that I really like about, sometimes I think that Bernie's defense of Medicare for all can be a little simplistic, or he doesn't really pitch the idea all that well, or as well as he could. But one of the things that he does that I really love is that whenever somebody brings up the cost, he just brings it back to the very simple fact that we all like to forget because we're on this island called America, that dozens of high-income countries all over the world have single-payer healthcare systems and have been providing healthcare to all of their citizens at lower cost, at better outcomes for decades. And that single payer is not the weird untested experiment that Biden and the moderates all love to say it is, but actually that our healthcare system, this weird patchwork of private and sort of public and everything, is the weird untested experiment that's failing. And that's why we're having this conversation. That's why healthcare is one of the most important things to people consistently across, the past several elections.
Right. This whole cost argument is so just on the face of it wrong.
Yeah.
The notion that we're going to spend more, all you have to do is every other country in the developed world has something like Medicare for all. And they all pay not just less than us, but usually a half or less to a third of what we pay. And that's just because they're cutting out all the profiteers from the system and all the administrative waste. I think I agree with you that when this comes up, you don't want to get into an economics argument with people. You don't need to be an economist to look at the rest of the world and be like.
Exactly. You don't have to get into the weeds to see that on the face of it, it's wrong.
Yeah. And I think, Bernie does answer something along those lines. But Biden's argument is that, oh, yes, it's less, but it's in public spending. And therefore, I want to ask him sometimes, would you rather pay $200 in private premiums instead of $100 in taxes? Because that's kind of what he's saying, right? So the last innovative argument around Medicare for all that we're going to look at comes to us via Amy Klobuchar from Minnesota. So, I thought every time I hear a new argument, I'm like, this is going to be the last one. They must have nothing left in their bag of tricks. But Amy Klobuchar got really innovative, and her new argument about Medicare for all is that there is not actually a debate around Medicare for all.
Listening to this same debate, and it is not real. It is not real, Bernie, because 2/3 of the Democrats in the Senate are not on your bill, and because it would kick 149 million Americans off their current health insurance in 4 years.
Oh, where have I heard this before?
It's like when my husband avoids a problem we have and I tell him he's ostriching.
What's that? Oh, you stick your head in the sand?
Yeah.
Okay.
It's just like, if I don't see it, it's not happening.
Yeah. And I think what she's doing is she's looking at Congress and saying there's not a strong majority in the Senate yet for Medicare for all. And therefore, there is no debate or movement around this for the whole country, right? It's like
That's why I'm sitting here at it on the Democratic debate stage talking about how there's no conversation about it at all.
Exactly.
For the seventh debate in a row.
To her, anything outside of Capitol Hill just doesn't exist.
Yeah.
Whereas vast majorities of people support it. And this is the number one argument in the debates. So, you might have to start acknowledging the reality of this debate. But then she closes with the oldie standard attack on Medicare for all, which is identical to what Trump argued. except that her number is somehow lower. She says like 149 million will be thrown off, where Trump said 180.
Oh.
Did you notice this?
I didn't even notice that she said that. I was just so focused on the first part.
That's just because Trump has the best lies. He has the perfect lies, the biggest of all the lies. He doesn't want to be outdone by Democrats on his lies about Medicare for all. So I think we're going to wrap up all the political debates and stuff. I had one final item, which is, as I was watching the Oscars and Parasite was racking up win after win after win, I was reminded of this interesting research that was done around the social determinants of health and the Oscar winners. Now, you might think there's no way I could possibly connect the Oscars to Medicare for All, but watch some magic happen right here, okay? We talk a lot about the social determinants of health. It's a little bit different from the healthcare system. There's now like a big body of research in the last 30 or 40 years that shows that the things that most impact your health outcomes, like how long you live, how likely you are to get sick or not, actually don't have anything to do with your access to healthcare or the quality of the healthcare you get. It has more to do with basically your role in society. Are you living in poverty? Do you have sort of control over your life? Do you have independence? And what's your self-perceived status within society? Do you feel that you are like way down on the totem pole with no respect, no autonomy? Or do you feel like you're like really high up in society and that, you have some control over your life? So equitable societies tend to have much better health outcomes, regardless of what their healthcare system looks like. And again, there's huge bodies of research that have found this over and over and over again, including there was one incredible study that looked at 72 years of Oscar outcomes. And they compared people who were nominated for the Oscars and won with people who were nominated for Oscars and did not win, and looked at their life expectancy afterwards. And incredibly, they found that controlling for everything else, like controlling for race, for gender, for where you live, all this stuff, that people who are nominated for an Oscar and win live 4 years longer than people who are nominated for an Oscar but don't win. And this was just part of the research finding that it's not just like if you're poor, you live less long. It goes all the way up the income scale, so that even the status gap between middle-class people and the status gaps between rich people lead to these huge divergences in health outcomes. And to put that into context, if you were to eliminate all heart disease, which, kills the majority of people, with stroke or heart attack, that would add less than 4 years to your life. So it turns out that winning an Oscar is better for your health than eliminating heart disease.
This sounds actually like an argument for participation trophies.
Participation trophies? Oh, maybe that'll give you like 1 or 2 years.
Exactly.
Oh, just like the kids get.
Right?
So that is it for this week. Obviously, a really busy week, but we're excited to get back at it next week and talk to you again. If you're interested in this sort of social determinants of healthcare side of the conversation, which is really important, it also kind of connects us to other sort of allied social movements. We actually do have a health policy training on our website at healthcarenow.org that talks about the social determinants of healthcare and the intersectionality with Medicare for All. You can also reach out to us at any time. podcast@healthcarenow.org is the email. You can hit us up on Twitter at HCNow. Send us your thoughts, send us your feedback. And there's going to be a really exciting national campaign launching just this coming week. So we're going to talk about that next week. And we'll have like a big action ask for the rest of you. So have a great week, y'all. We'll talk to you soon.